I'm Kyle Keel. Morgan is on assignment today. Well, if you've ever dealt with joint pain, inflammation, or have had difficulty moving, chances are you've seen an orthopedic doctor. And depending on the pain, you may be wondering, do I need revision? Do I need a replacement? Well, here to answer all of our questions is Dr. Craig Moe. He is a board-certified orthopedic surgeon with orthopedic specialists here in the Quad Cities. Dr. Moe, thanks so much for joining us today.
Thank you so much for having me.
Yeah, I know you're a busy man, and you all are always busy at orthopedic specialists. So, you know, the orthopedic specialist serves Davenport, Clinton, and the entire Quad Cities area, and it's the area's only all-fellowship-trained, board-certified group of orthopedic surgeons. So you've got many doctors on board that specialize in different aspects of orthopedics. So what is your specialty?
I specialize in hip and knee replacement. I'm fellowship-trained in that, so that means anything from people with arthritis that need a primary hip or knee to people that have already had a hip or knee replacement that need them redone.
So what does fellowship trained mean?
So essentially our training is you do your med school, then you do generally 5 years of orthopedic surgery residency, which is just kind of the basic orthopedics.
Yeah.
Fellowship means you did an extra year generally of training in something special, you know, something that you do primarily.
Sure, and of course you specialize in the hip and knee, so we'll kind of focus on that aspect here. So what qualifies someone for revision of the hip or knee joints?
So generally somebody that has had a hip or a knee replacement that is having issues with it.
Okay.
So either can't move it the way they want to, they have continued pain, perhaps infection, you know, drainage, things like that. Anybody that's had a hip or knee replacement in for a while that just isn't totally happy with it, or if there's an issue with what was implanted originally.
So at what point should we be concerned with our bodies if we think that we need to go the route of a hip or knee replacement? So that obviously comes before that step.
Before a revision, correct, yeah. Really, it's, you know, people come to us all the time that have arthritis. So generally it's for arthritis, the treatment of arthritis. Sure. Generally hip or knee pain. Knee pain is pretty obvious. Hip pain is usually like significant groin pain. So people don't realize that a lot of times, that the hip joint is actually in the groin. And if that's interfering with your quality of life, there's no need to live like that. You know, if you're having pain to the point where, oh my gosh, I just can't do the things I want to do, that's when it's time to see us.
And I'm thinking of a family member who's gone through a hip replacement, and yes, you know, when you're going through it, you're in a lot of pain, but once you recover from it, I mean, it's like you're a completely different person.
Especially hip replacements.
Yeah.
Hip replacements are the most satisfying surgeries of all surgeries, where you essentially wake up from the surgery feeling better.
So talk about how invasive these surgeries are.
You know, it's an incision is based on how big the person is, essentially. Sure. So there's no real minimal way to get into the hip. There are some things that have been developed, and in general, it's just it's a routine incision to be able to do the best quality work we can and be able to see what we're doing.
And of course, the first step to finding out if you need any of these operations done is to see an orthopedic specialist. So it's important to see someone, but it's also important, if you get some sort of diagnosis, to gather a second opinion, as is anything health related.
Correct. Yeah, for sure. You know, again, a lot of times there's a lot of people that do primary hip or knee replacements that may not do a revision or may not do a redo of that surgery. So you may not get the answers you want from your primary surgeon. So in those cases, if you just feel like you're not getting anywhere and you're still having pain and questions haven't been answered the way you're happy with, that's when it would be time to see a second opinion.
Okay, so always important to get that second opinion. So I wanted to talk a little bit about yourself and your background because you are new here to the Quad Cities area. You started as an orthopedic specialist back in August. So it's been a couple of months and you're relatively new to the Quad Cities, but you are not new to orthopedics because you have a couple decades of experience.
That's correct. Yeah, I started out initially practicing right out of residency in Wisconsin in the Milwaukee area.
Okay.
Actually went back and did a fellowship, which is a little bit unique about what I did. I actually practiced as a general orthopedist doing everything, and decided to refocus on doing just hip and knee replacements. We moved to Iowa from Wisconsin to move closer. My wife had some family in Sioux City, and we wanted to be closer to them as her father was having some medical issues. And we eventually settled in Des Moines, and just things didn't work out the way we wanted to in that town, so we decided to come out here to the Quad Cities.
Yeah.
I had an aunt that was, you know, aunt and uncle that were in Moline, and you know, my grandmother was in my grandmother was in Clinton, so it was all kind of area that I was familiar with, so it really was a good fit.
And so how's the first few months been?
It's been great. I really like the Quad Cities. I've been out kind of going along the river and experiencing everything there is here. We're really excited to be here.
All right, awesome. So keep up the great work, and thank you for coming in to answer a couple of our questions. And if you want to learn more about the doctors, the specialists, and service provided, or as well to book an appointment at the orthopedic specialist, you can visit osquadcities.com. Again, Dr. Craig Moe, thanks so much for stopping by today.
Thank you.